Hello, it's only me again. Not uploading as consistently as I'd like and previously said I would, which is a shame because there's so much we have to talk about. And as universities for pharmacy throughout the UK are preparing to get the course ready for their students, well, now's a great time to talk about how the MPharm degree starting from 2021 is so different to the degree from the years gone and what these changes mean. So, let's jump straight into it. For anyone who's already a qualified pharmacist like myself from previous years, the degree we entered was effectively a science degree as well as one to come out of it as a qualified pharmacist. It was 4 years in university where you completed the master's degree and 1 year's training known as the pre-reg year. So after the 4 years, you still had a recognised master's in a science degree, but only after meeting competency set in the pre-registration year and passing the assessment at the end of it could you practice as a registered pharmacist. As I mentioned in the previous video of why I did pharmacy, it was kind of an all-rounder, often covering various topics, which meant that once you had obtained that degree, there were a couple of options available. As we looked at previously, in years gone the actual pharmacist roles that you could get as a result of the degree directly were primarily three: community, hospital, and the most competitive, which was the industry pharmacy. But with that said, the degree itself did open other doors for indirect roles. So while the pharmacist roles then may have been limited, there was still the option of further research, regulatory roles, going into economics, other science related roles, university roles, and so on. Now, for currently qualified pharmacists, there's also another qualification that can be obtained that allows them to become independent prescribers, or IPs. This added qualification allows the pharmacist to consult with patients and to write prescriptions. Currently, for a pharmacist to do this, they need to enroll the university and complete a prescribing course, which is typically around 9 months. One of the conditions of this course is to have to arrange to have a designated supervisor, which was traditionally a doctor, to supervise them and sign them off, and this is usually a total of around 90 hours in practice-based setting with the supervisor. Up until now, some pharmacists chose to do this, but by default a pharmacist who qualified is not a prescriber. Most of the currently registered pharmacists are not IPs. There are more pharmacist roles now than ever before. Pharmacists are working in prisons, addiction units, community, hospital, industry, GP practices as part of a cluster in the army, regulatory, and so on. And these roles may well expand as what the pharmacist does continues to change. There have, as I mentioned in my first video on community pharmacy here, been long debates and discussions about what the pharmacists do and their role, and unfortunately how they've been so undervalued over the years. Yet still, here we are, where pharmacists are still integral, still accessible, still around, and as the pandemic had shown, more necessary than ever. But as of this year, there's another layer to it all. The pharmacy degree as we have known it for so long is changing quite considerably and incredibly quickly. From this year, for students entering their first year into the degree, it's quite different. Now you're not entering the same science-based degree as it has been over the years, but one where you go into the degree and come out of it with the intention of being a qualified pharmacist. The plan is that the degree now incorporates the placement-based element where you work alongside other healthcare professionals and upon qualification come out as an independent prescriber. Alongside the changes to how the training year is carried out and the degree itself, this is a huge change and will be interesting to see exactly how it pans out. It effectively means that in 5 years' time, when this first cohort of this newer pharmacy degree qualify, they will qualify as independent prescribing pharmacists. While many of the learning outcomes may be similar, the degree will be quite different to that which currently registered pharmacists qualified with. So, what does that mean? Well, the intention is also that there will be a push that currently registered pharmacists will complete the course to qualify as independent prescribers. The problem is, how will all of this be carried out? That's still to be determined. Some pharmacists like myself have found it very difficult to find as a designated supervisor over the years in the first place, and without some form of a centralized system that helps with that allocation, this can be pretty difficult, especially given how many registered pharmacists there are. Other pharmacists may not have entered the degree with an intention to prescribe by the end of it anyway, or might find it difficult to have the time to incorporate the training. So what we could end up with in 5 years is 2 cohorts of registered pharmacists. The newer qualified pharmacists that are prescribers from their first day, and many already qualified pharmacists who enrolled in the pharmacy degree before 2021 that are yet to be prescribers. Of course, there's still quite a lot to be figured out here. In theory, a move of this kind kinda makes sense. Pharmacists are in a great position to be prescribers given their knowledge of medicines and general all-round knowledge in pharmacy fields. The public need more access to prescribers given the current waiting times to see doctors, and so this may be a move in the right direction. However, there are a lot of questions that it also brings forward. Will this eventually lead to too many prescribers? How will the currently registered pharmacists and the pharmacists enrolling from this year reconcile in a standardized way from 5 years' time? What does it mean for the holders of the current degree itself? How will there be enough supervisors for both registered pharmacists and the newer cohort of pharmacists that will qualify in 5 years? More importantly, why have you not already subscribed and told all your friends about this channel? Sorry, the last one I couldn't resist. The next 5 years will be very interesting to see how it all develops and how the roles change. It certainly seems to be the case that only time will tell how this works, but in any case, it's going to be a very interesting next few years. What are your thoughts on the situation? As always, I'd love to hear your views. Your support is much appreciated, so please do like, share, comment and subscribe, and hopefully I'll see you soon.